I think one of the reasons that community physicians in particular should feel confident and safe about sending their patients for care at the spine program here is because you are getting level 1 tertiary care at a community hospital where people need to drive 5-10 minutes. We have state-of-the-art equipment, and you have physicians who are Ivy League trained, who have done this for years, who are able to do as much complex stuff or even more complex stuff than some of the spine surgeons in Boston, and it's right at home.
The Lawrence General Spine Program availability of access is very good as compared to other practices or other hospitals in the area. So if a physician contacts us and has a patient that is acutely in pain and needs to be seen, we could certainly accommodate that and coordinate with the primary care doctor to see the patient, if not on the same day, then within a couple of days to take down the wait time that the patient might have going elsewhere.
It is very important to have all the treatment options available in one location. And certainly coordination of care for your symptoms of back pain or neck pain would be much more comprehensive. And so the majority of neck or lower back conditions we can treat locally.
90% of patients who have spine problems are non-surgical. But if people go through that entire process where they've worked with our therapist, they've worked with our pain management specialist, they worked with our physiatrist, if they want, they've worked with an acupuncturist, and they're still having arm pain, leg pain, difficulty walking, that's when they really are a good candidate for a surgical intervention if their imaging studies and their complaints match up. When they come into the hospital for their surgical procedure, there's an entire team that is multidisciplinary that takes care of them.
This team works very well together. We communicate well with each other. We are looking out at what's best for the patient. And I think that's what sets us apart from other facilities, which may not have the team approach.
It has to really be individualized. The type of approach, the kind of surgery really varies from patient to patient. And spine surgery has improved a lot, not just with technological advancement, but with the technique as well.
Being able to apply all these minimally invasive techniques increases the precision at which the implants or the surgery is done to a much greater degree. Number 2, it increases the speed at which I can operate. And that's important because if we can decrease the time of their surgery, it gets them off the surgical table sooner, which means that they're able to get out of the hospital quicker because they're able to do physical therapy a lot sooner.
Our goal is to get the patients back on their feet as quickly as possible and remain pain-free for the remainder of the time. Most part, patients are thrilled to come here. They ask to come here, and by referring patients to here, you are improving patient comfort and patient outcomes.
With the opening of the new surgical center, I'd like to see the spine program continue to grow and become the go-to place for our local patients in the community.
The spine program here at Lawrence General is going to continue to expand so that we're able to give the same level of care as any well-established hospital in the Boston area without people having to go down and drive a long distance to get it.